Thank you, Dr. Sruti Sariya and Dr. Surendra and participants from Hindi. Good evening, good afternoon, and good morning. This is the 2019th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NIKUNJ Trivedi from UK. Let us begin the session with 1 minute silent prayer. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day at the YouTube. So that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. Now you can search at IFPH homeopathy at YouTube so that you can get the previous videos of our presentations. And let me come to today's guest. Today's guest is our beloved Dr. NIKUNJ Trivedi, M of Homeopathy, Faculty of Homeopathy, London, UK. He is one of the most reputed speakers in the infertility chronic diseases and his application in homeopathy. He is a collaborator with the Radar Opus, where he collaborated his creation of a repertory of infertility. He is providing regular clinical training at his UK clinic to interested homeopaths, and he is very popular on IFBA's forum. He has presented so many beautiful sessions and worthwhile sessions also. He is Dr. Nikhil Trivedi started his clinical career in India in 1980 and moved to England in 2004 and became a British citizen and settled huge practice in literature. And he is a proud member of the Faculty of Homeopathy and fully registered and insured member having MF Homeopathy, Faculty of Homeopathy, and he was honored with the Fellow of HMA UK and Fellow of British Institute of Homeopathy. Dr. Nikhil Trivedi practiced homeopathy since 1980, and he was affiliated with various homeopathy colleges in Gujarat and India. With his vast clinical experience in gynecology and obstetrics, he practices infertility, covering both male and female problems. When he was in India, he invented a technique to open blocked fallopian tube with intrauterine use of homeopathic remedies. He opened significant number of blocked tubes successfully. He has presented most of them in a forum also. He has worked with the sperm abnormalities and he potentized the L-arginine to correct the sperm abnormalities, which has helped many patients to improve their sperm count and chromosomal activities at sperm. Also, he is working on oxidative stress in semen. It is underlying cause and of sperm DNA damage and impairs basic parameters of semen affecting fertility very seriously. He also worked on estrophilia, considering the real obstacles of cure in many clinical conditions. He is one of the collaborators of repertory of infertility with the Radar Opus and the most widely used software in homeopathy. His publications related to infertility are a repertory of infertility, Materia Medica on sexual disorders, sperm disorders, and homeopathy, and mind or menopause. Today, our beloved guest is present, Dr. Nikhil Trivedi, is talking about can homeopathy help in iatrogenic condition, a very big question to all. So let us see how important homeopathy in iatric conditions. Welcome, sir. Please unmute, sir, your co-host.
Okay. Am I audible?
Yes, sir, everything fine.
Okay. Thank you. Yes. Today is 219th day of uninterrupted webinar from the IFPH, and really I am proud to be a part of for presentation on the heterogenic conditions and how homeopathy is working on it. So, in our day-to-day routine, when we come across any of our friend, family, any patient, and in general talk, when we come to know that what are the medications they are taking, some people they are taking painkillers, some having some medical conditions like blood pressure, thyroid, diabetes, they are taking regularly taking, and the medicine is become a part of their life. So when patient comes to see a homeopath, being a homeopath, we are taking the history of the patient, and when we are taking history of the patient, we come to know some weird symptoms. And when we come to know about some weird symptoms, then we have to address that symptoms in our homeopathic way. And today we are going to discuss that how heterogenic complication is causing problem, side effect, and complications to our patient's life. So let me give a one small example of one of my patient. Patient was brought to me by one of my old patient. The 38 years old lady, she had a problem with depression. I asked that, why you are feeling depressed? And that lady told me that my marriage was a sort of a forced marriage. I was not given enough time to decide and to choose my husband, but still I am living. Then I said, okay. And what medicine you are taking? What your GPS or your consultant has prescribed the medicine? And she was taking a Prozac. Prozac is a fluoxetine. She was taking 20 milligram. And Prozac is a short of a SSRI, means selective serotonin reuptake inhibitor. Then I said, okay, how do you feel with that? She told me that I'm not feeling right. Okay, in which way you are not feeling right? Then she told me that I got a lot of anxiety. I feel panic. I don't concentrate. I don't feel to eat. And I said, okay. Then I asked that, do you have any other habits? And she said, no. But her friend told me that she having a very bad habit of eating a raw rice. A handful of raw rice she was eating 3 to 4, 5 times in a day. Sometimes she used to wake up at night. She was going to the kitchen and she was taking a handful of rice and she was eating that. So this symptom she narrated to her consultant, and her consultant has labeled her as a OCD, that is obsessive compulsive neurosis. And it is okay. She had a problem with the sleep, insomnia. She had a headache as she was not getting enough sleep. So she was getting headache. She had a disease spells. She had a drowsiness and she had a confusion. Sometimes she was complaining that I feel awkward. I feel clumsy. I drop the things from my hand. And I said, okay. She had visual disturbances as well. So she was not able to drive. And that's why her friend has escorted her from Melton Keys. It is about 55 miles from my place. So she was escorted by her friend for the consultation. So the GP and consultant has labeled this as a OCD. But as a homeopath, I took that thing into consideration and I took the rubric as a abnormal appetite for abnormal things, and that's pica. So I gave a calcarea carb followed by Sina, and she was cured within a month. So this is the heterogenic condition that what I have explained to you. So by that way, you can come to know that when there is a misdiagnosis is leading to a different direction and patient is suffering. Now patient is completely okay. No problem since past 6-7 years. And she has just sent me wishes at every Diwali time. So this is the way how heterogenic condition can develop. And now we will go more in details with some PowerPoint presentation as well as some routine medication that what we come across every day with the patient's interactions. So am I allowed to share my presentation?
Yes, sir. Yes,
Dr.
sir.
Ganesh, please.
Yes, sir. Yes, sir. You can, because you are co-host, sir.
Yeah.
Yes, everything fine, sir.
Yeah.
Yes, we can click. We can
Yeah.
make it big screen,
Yeah.
sir. Right, sir. Okay. Fine, fine.
Okay, so paying tribute to our master who has taught us to treat the heterogenic conditions, so our homage to Dr. Hahnemann. Yes. Now, every system of medicine always aim to heal, cure, relieve, alleviate, and relax the suffering of mankind. But simultaneously, every system has its own limitations. We cannot do any surgery, and the surgeon cannot do homeopathy. So these are our limitations. And every system having a something very good in it, but it's not 100%. As per the organon of medicine, if we refer the aphorism 6, what our master wrote, that physician should be non-biased, the unprejudiced observer. So we should not be biased for any symptoms or any sign that what patient give or what we observe. But we should consider which other has not considered. So in that sense, I would say that we should not be biased for any symptoms and any system of medicine. Whether it's allopathy, whether it's Ayurveda, whether it's Unani, we should not bias for that. And we have to find some important clue out of it. But we should complement each other. So homeopathy is always considered as a complementary medicine. And as I earlier talked about day-to-day routine conventional medicines, that what our patients, what our relatives, friends are taking, these are the painkillers, medicine for the diabetes, medicine for the blood pressure, medicine for the acidity, medicine for the cholesterol, thyroid, diuretics, asthma, allergy, what not. There is a long list. But these are the commonest medicine that what we come across in our day-to-day routine practice as well as in day-to-day routine life with the patients. Now, let us remember the organ of medicine again, and we are going to the aphorism 3 that Dr. Hahnemann has well explained the knowledge of physician in aphorism 3. In advanced medical science, nowadays, if we consider, then science is advancing like anything. Whatever we have studied long back, that has been completely changed. There are a lot of new invention, lot of new techniques, lot of new medications, lot of in homeopathy, lot of new provings has been emerged out. And in advanced medical science, when patient comes to us, we must have a sound knowledge of medicine, that what patients are taking, and if any side effect they perceiving or they are experiencing. Every medicine, when patient buy medicine from the pharmacy, it comes in a packet. And in that packet, there is a one leaflet. That leaflet explains everything in it. So patient usually read it. And when patient comes to us, they are always asking some questions. And for that, we should be prepared to answer that questions. So many patients, they are doing web searches. They perceive their knowledge from the social media, and they grow and they get wrong impressions, wrong interpretations, false concept, and some misconcept from what they read. Every day, we all are getting Google doctors. They are coming to us and they are asking sometimes very weird questions. At that time, if we have enough amount of knowledge of what medicine they are taking, then we are able to answer their questions and we are able to quench the thirst of their inquisitiveness. So here, knowledge of homeopathic remedy and its relationship with other system of drug interactions are very important. So can homeopathy help in heterogenic conditions? And my answer is yes. Considering the constitution, considering the miasm, considering the diathesis, and considering the psychosomatic evaluation, considering the root cause of the condition, causative factor, obstacles to the cure, and finding maintaining cause. That's very important. Maintaining cause is very important in treating any condition. The homeopath can prescribe the right simillimum to remove the side effect of concerned condition. So let us understand what is heterogenic. The term heterogenic originates from the Greek, literally meaning brought forth by the healer. It was unintentional thing. Any unintentional, any unintended illnesses or condition that arises as a result of medical procedure for the purpose of diagnosis, for the purpose of intervention or treatment is called the heterogenic condition. And common heterogenic conditions usually observed with side effect of the medication, surgical complications, hospital-acquired infections, and diagnostic error. These are the common heterogenic conditions that what we come across in our practice. And here I would like to express my views about those who are doing the classical way of homeopathy. We are doing a clinical way of homeopathy. Classical homeopaths, they are giving less importance to the pathological results. And clinical homeopaths are always looking to the blood results, the X results, to the MRI, and whatever procedure has been done to the patient, like surgical operation, histoscopy, laparoscopy, endoscopy, all the scopies, all the scans, we are also try to finding out the deep insighted pathology out of that. So this is very important to find out the hidden pathology by looking to the clinical test results. So, effect on patient safety. Iatrogenic conditions are the adverse effect caused directly by medical treatment or intervention affecting patient safety. So, patients are not safe 100% with all the procedure, with all the medication, with all the surgery, and with all the intervention. So, effect of patient safety we have to evaluate as well. So, statistical significance in healthcare. Statistically, up to 10% of the hospitalized patients, up to 10% of the hospitalized patients may experience iatrogenic adverse events. Why? Because patients are catching infection from the hospital. That is called the cross infection. So up to 10% of the hospitalized patients may experience iatrogenic adverse events, emphasizing importance of patient safety measures here as well. So now we are going to discuss a case of hysterectomy. Lady was advised to undergo a hysterectomy. And what complications she developed after the surgery. A 36 years young, a 36 years old young lady with history of profuse menstruation related with uterine polyp, endometriosis, and bilateral multiple ovarian cyst, along with hirsutism, along with virilism. Because this lady, at the age of 36, she developed all the gynecological complications. Shinge uterine polyp, profuse menstruation, endometriosis. Endometriosis itself is causing a profuse menstruation. Bilateral multiple large ovarian cysts, that is also causing a sort of a hormonal imbalance, and hirsutism, that is unwanted hair on the face. She was treated by local gynecologists for more than 2 years. And because she having a profuse menstruation, menorrhagia, she was advised Mirena coil. She had it for 1 year, but no relief in bleeding PV. She was ended up with pan-hysterectomy, for which she was not at all willing. But there was no any solution, there was no any other resources to overcome this condition. So she has to undergo hysterectomy. Abdominal hysterectomy was performed under general anesthesia. During surgery, blood transfusion was given, and she recovered in a due course of time and resumed her routine work. After 8 or 9 months, gradually she developed some complications like frequent mood swings, severe anxiety attack, panic attacks, making her panic for small things. If some work is pending, she developing a panic attack. Oh, how can I complete this? She has also developed an emotional outburst on slightest provocation. If her children say something to her, she bursts out in tears. If her husband says something, or if sometime neighbor also tells something, she was bursting out in tears. She has developed a hot and cold flashes. She was complaining of the dyspareunia as well. And she had a hyperpigmentation that you can see in the picture, and you can see she having some threading. So on the lips, you can see there is a presence of hair follicle. She has a severe hair loss. That also you can see here, that hair fall is great, very heavily she was losing hair. She had a sleeplessness. She was not able to get good enough sleep at night. And she had a incontinence of urine. The slightest coughing, sneezing, laughing, she was just tripping a few drops of urine. And then she has to wear a panty liner. That's what she told. So I put a diagnosis of iatrogenic menopause because she underwent a hysterectomy. All the uterus, ovaries has been removed. That's why she developed all this complication. Now considering the homeopathic approach. So I selected some general rubrics, that is bad effect of profuse blood loss. So she developed anemia. She was anemic, very pale, very weak, got scarred easily. Mental trauma. She was not ready for surgery, but she has to undergo. She must undergo because gynecologist told that if you don't undergo the surgery, you might end up with another complications like cancer. When she had a hysterectomy, when she was in hospital, she was catheterized for collection of the urine. So she had a physical trauma of the surgery, and she has a mental trauma that she was forced to do the surgery. Because of the hormonal imbalance, she had a hot and cold flashes, and she had a psychological impact of foreign body in uterus. She was thinking that something in my uterus. And what something? That was Marina coil. She was put a Marina coil in her uterus for 1 year. And that's why she had that psychological bad effect, that foreign body in the uterus. Bad effect of blood transfusion and bad effect of general anesthesia. When general anesthesia is being given to the patient, doctors means anesthetist is using laryngoscope. Laryngoscope. Yeah, this is laryngoscope. And with that, they are pushing the tongue to intubate. They are inserting the tube. And that is also causing a soreness in the throat. Sometimes patient may feel the dysphagia. Sometimes it feels like something has been as a plug in the throat. So all this complication she developed after 8-9 months. So I labeled this condition as a heterogenic menopause, premature menopause, early menopause, whatever you want to say. But all this complication is related with the surgery. She was successfully treated by considering all the rubrics and never well since then. Sepia and bad effect of surgery, physical trauma, mental trauma, exploitation, humiliation, that is tapisagria. She's okay now. Her hot flushes has gone. With the tapisagria, she has developed a good control over the bladder. She was not catching any recurrent UTI now. And in terms of her confidence level and in terms of her emotional stability, she is more stable now. And I explained that this all happened because of the surgery. If you wouldn't have undergone the surgery, this would never have happened to you. So she has accepted the situation. She has accepted that, okay, whatever it is, it is. And right now she is doing well. So how the homeopathy is helping the heterogenic condition, this is a big evidence-based case. That's what I have presented here. Okay, now we are coming to another case, a case of benign prostatic hyperplasia, enlargement of the prostate in a male patient. We have gone back. You have to go forward. A case of benign prostatic hyperplasia. A 55 years old early retired gentleman. She is a US citizen, but she has settled now in England. That gentleman underwent TURP, that is called the transurethral resection of prostate. He had a complaint of difficult to start urine. When he was developing an urge, when he was going to the toilet, he was not able to pass urine. He has to wait for a couple of minutes and dribbling after finishing urination. He had an ineffectual desire to pass urine. He has to wait for a longer period of time to pass urine. And he was developing a sudden urge to pass urine, but unable to hold or unable to wait. And that's why sometimes he was meeting with some accident as well. Visited GP and urologist, and they prescribed him oxazocin and finasteride. But he was not felt much relief with that. After that, he developed a more night frequency, and he was training a lot to pass urine. Secondly, he was on Monjaro, injection Monjaro, that is tirzepatide. Tirzepatide. It is for the diabetes and it is for the obesity. He haven't had any diabetes, but he was taking that Monjaro for the weight reduction, and he lost his weight as well. But as his night frequency has increased, he was not able to hold urine. The doxazocin was not helping. Finasteride was not helping. So he underwent a TURP. That is called the transurethral resection of prostate. So what is TURP? That is transurethral resection of prostate. And what is the indication of TURP? The failure of treatment with medication. He was given 2 medications for the prostate. No relief. So there was a failure of treatment with medication. Obstruction. Urologist suspected there must be some obstruction, and that's why he having this type of thing. And at one point he developed a double string. Instead of single string, urine was just splitting into part. So that was suggestive of stricture, and we call the obstruction. And associated complications like renal calculi, recurrent UTI, and renal failure, etc., is indicative of doing a TURP for the urologist. So here you can see that the cystoscope is going inside the bladder, and here this part, the cutting loop and cutting electrode, is just removing the enlarged part of the prostate. So after TURP, what happened? He developed complications. He developed incontinence. He had a dysuria, painful urination. Sometimes he was complaining of pain, and pain was sometimes unbearable. He had a mild hematuria because of the catheterization. He also developed a sort of erectile dysfunction after resection of the prostate, and he developed a retrograde ejaculation. He complained that I could not ejaculate. So where the semen is going, where the prostatic fluid is going, it is going in the bladder. And when the urine examination was done, it was found presence of sperm in the urine. So that's why it's a clear-cut indication of the patient having a retrograde ejaculations confirmed by urinalysis. So this was the complication was done after surgical innervation to remove the extra enlarged part of the prostate. He developed all this complication. And with his all this complication, when he came to me, I took all the history, detailed history, and I repertorized and I found Lycopodium clavatum. With that, he became completely okay. At last, list is very long and time is very short. Considering inherent medical risk, misdiagnosis by our colleagues, physicians malpractice, which is very, very common nowadays in India, whether it is necessary or not, they intend to do the surgery. Any pain in abdomen, they consider it's appendix. And at least 90% patients having a pain in abdomen, their appendix has been removed without proper investigations. That's what I have observed when I was practicing in India. Many times patients develop a severe chest pain. That could be because of the costochondritis. That could be because of the acid reflux. That could be because of the other reason with the chest infection, with the hyperacidity. But when they go to the physician, they put a great fear of heart. And many times patients has been admitted in hospital for nothing. But they put a fear in their mind about the heart attack. Medication error is very common. Surgical error is very common. Recently, in England, I'm not going to give the name of the surgeon, but one of the pediatric surgeon in the Great Ormond Street Hospital, he came under investigations. And he amputated a leg of one girl. Instead of doing surgery on the left leg, he amputated the right leg. And it came into the news. So that is called the surgical error. Whatever we can do as a homeopath, we must do. And thanks for having me on IAPH platform. I really enjoyed to share all my experience, all my expertise in terms of treating the iatrogenic conditions. And if we consider in surgical point of view, let us start with the anesthesia. So when anesthesia, laryngoscopy is very important. When the anesthetist is doing laryngoscopy, means they are putting the laryngoscope inside by intubating the patient. The first mild side effect is sore throat, dysphagia, and hoarseness after recovering from the anesthesia. And serious complication is happening like aspiration pneumonia. Patient having inhalation of the vomitus. It goes in the lungs and patient is developing a Mendelssohn syndrome. We call the aspiration pneumonia. Sometimes blood or other fluid also goes into the lungs and patient has a pleural effusion as well. So aspiration pneumonia or Mendelssohn syndrome, that's a very common complication during anesthesia. Sometimes patient developing a airway trauma. Sometimes patient having a tension pneumothorax. But when we consider all these things, we have to think about the homeopathic remedy as well. When patient having a hoarseness after trauma, We can think about the Hipar sulfur, we can think about the arnica, we can think of the staphysagarria like this. So as per the condition, we can repertorize, we can select, and we can administer the medicine to the patient. And when patient having a such type of complications after surgery, after operation, patient is also developing a sort of a PTSD, post-traumatic stress disorder. That is also there. Patient also having a heavy risk of developing a hospital infection, cross infection. Any abdominal surgery, if we consider any abdominal surgery, when patient recovers, patient after certain period of time, patient is developing a side effect like pain, swelling, sore, bruise feeling, as we have seen in the arnica, and chances of infection, chances of blood clots. Patient may develop DVT, deep vein thrombosis, or pulmonary embolism. This is also very common. But here, homeopathy can't help. When patient is developing a stroke, when patient recovered from the stroke, then homeopathy can help. But when patient is in acute stage of stroke, we are absolutely helpless. So we should know our limitations. And in such condition, patient will never come to a homeopath. That is also true. Shock. Patient is developing a shock, surgical shock, oligamic shock, hypovolemic shock like things. And later on, a patient recurrent coughing and all, patient is developing a short of a incisional hernia. After catheterization, patient is developing incontinence. That's very common. We have seen in our practice that patient having a sort of a leaking when sneezing, when coughing, when laughing out loud, patient having a few drops that leaks. And sometimes patient are complaining that this is quite embarrassing for us. At the time of operation of fissure, when it has been, as I have worked in a surgical department and gynec department, so I know all this procedure because it has been done in front of my eyes. I have seen. Sometime I have done that as well under the supervision of my boss. So when the fissure, patient of fissure comes to us, at that time, what doctors are doing that they are putting the fingers and they are stretching the rectum. So they break all the septa. But after that, patient is developing incontinence of the stool. So when patient is developing urge, patient may leak some stool, and that is also very embarrassing situation for the patient. So finger stretching and cutting the internal fiber. Surgeon always cut the internal fiber so patient doesn't have any pain. That is also leading to another complication. And when patient had a severe hyperacidity, the surgeon used to do the GJ, gastrojejunostomy, GJostomy. So they cut the vagus branch of the vagus. Patient doesn't feel any pain, but patient was developing a sort of a belching, meteorism, bloating sensation, constipation like that. So at that time, our naxomica is at the hell. When patient having a meteorism, we can use the carbovage, we can use the lycopodium. These are the medicine, but we should consider the constitution, diathesis, miasm as well. This is all the symptomatic, I'm telling you, but we should always thoroughly take the case and we have to repertorize the condition. So I told about the Monjaro injection, that what my patient was taking, right? And he has stopped after TURP. So Monjaro, terzipatide, it works by activating two receptors. That is called the GLP-1 and GIP. It increases the level of incretin. It's a hormone, and that is causing a side effect. Risk of hypoglycemia or risk of hyperglycemia. So patient either lose the weight, but simultaneously patient also develop hypoglycemia. And for the hypoglycemia, when patient gets sweating, when patient is losing the control while driving, when patient having a disease spells and all. So at that time, we should tell patient to be careful when you are taking anything which is causing any side effect to you. So over-the-counter medicines patients are taking like ibuprofen, and that ibuprofen is itself causing a bronchospasm. When patient has bronchospasm, after taking ibuprofen, our medicine, antimonitat, Drosera, and Cuprum, is very good, and it relieves the bronchospasm very quickly. Diclofenac having a tendency to develop a bleeding. Patients are taking diclo frequently in India after COVID that I have seen. So homeopathic medicines for the pain, we have arnica, we have brownia, we have ledum, we have plumbum. So considering the constitution of the patient, we can administer all this medicine as well. Homeopathic medicine for ulcer, those who are having an ulcer, and after taking all this painkiller, patient trying and patient having tend to develop ulcer. And with that, our Robinia, sulfuric acid, arsenicum album, Felturi are very good to relieve all this complication. Statin, widely prescribed to reduce the cholesterol. So when patient is taking statin to reduce the cholesterol, and when patient is taking blood thinner, it causes muscle pain, tiredness, fatigue, and rhabdomyolysis. Very rare condition, but it's serious condition. It also causing liver damage. So at that time, we can use the cholestyrinum. We can advise our patient to use more pistachios. Pista. University of Pennsylvania has proved that pistachio, 63 grams of pistachio every day is reducing the cholesterol. Steroid, prednisolone. Sometimes it's a life-saving drug, but prednisolone used for autoimmune disease, eczema, psoriasis, rheumatoid arthritis, and the side effect of the prednisolone, it reduces the bone density. It is causing bone density. So it takes away all the calcium from the bone. Prednisolone is also affecting the growth, and it is causing growth retardation in children. It also causing water retention. It is also causing weight gain. So in that case, the totopathic cortisone is at the help, and epocinum is also helping the patient to take out all the extra water from the system. Antihistamines like chlorpheniramine maleate, cetirizine, chlorotidine, which causing drowsiness, tiredness, fatigue, confusion. So in that case, for natrum sulph, if we use natrum sulph, is homeopathic antihistaminic. So this all about the heterogenic condition and the medicine which is causing problem to our patients. That what I have tried my level best to elaborate over here, and hope you would have enjoyed this presentation. This is all about my publications, and thanks for listening, and hope you have enjoyed this. And thank you very much to IFPH, those who are continuously doing this noble work. And for that, there is no words to say thanks. Thank you.
Yes, thank you very much, sir. It's really a very good session indeed. Not simply someone is benefiting from your presentation, but it is a really a worthwhile presentation to show the world that homeopathy can do such wonders in such condition. Because the case shown, you have presented 3 cases here, and all the cases were due to the iatrogenic conditions, due to the patient suffering from the mismanagement or some defect in the treatment. But unfortunately, most people, most patients are not realizing what is happening with me or he or she, because after admitting in the hospital, they may be taking some medicines or some treatment, or some kind of um, in things by a physician or surgeon. But thereafter, patient may suffer a lot of problems. But patient believe that it is because of the disease itself. But in India, most probably most of the doctors hide these things, and they may not tell the patient that this is because of the result of what I have done to you. But in West, it is not like that. They will have to say what is the real disease and what is how it developed. Am I right, sir?
Yes, sir. In England and in USA, but it is more commonly in England, there is a one body that is called the NICE,
Yes.
National Institute for Health and Care Excellence. And everyone has to follow the guidelines of the NICE, whether it's a surgeon, whether it's a physician, or whoever it is, they have to follow the guideline of the NICE. As a homeopath, we have to follow the guideline of Faculty of Homeopaths and MRHA. So we cannot treat certain conditions. Same way, the allopathic conventional practitioner, they cannot do certain things because of the NICE guideline. And I'm sure that there is nothing like that in India, and that's why all the malpractices are going on.
Yes, sir. That's the reason why, at the time of COVID, many patients were admitted in the hospital, and they came with some of the most troublesome problems in their life. And but they what the authorities told them that it is because of this particular disease, but actually the disease is not the matter. There, it all was developed due to this yet medicinal aspect, as well as the treatment protocol they followed by the. We all know that there is no medicine for viral diseases for these from the so-called modern people, but still they apply this medicine to the patient where the disease itself was a viral one, and as a result, a lot of the medicine didn't work, and the medicine made more problems than what it is supposed to do good. Yes, I'm inviting Dr. Hibbert to say a few words.
Doctor, how are you, sir?
Well, sir, how are
Nice to
you?
see you.
After very, very
Fine,
long time
doctor,
seeing you.
fine.
And here is our most respected Dr. Kuru.
Yes, yes, sir.
Sir, I want to say one thing.
Yeah.
You told that in such cases like the stroke and attacks, I have managed 4 cases with homeopathic medicines, and they all rescued. So in stroke cases, that is my experience. So I think that it is we can do something in such conditions. I've told that it is very difficult for us, but I think that for the time being we can do, because they are taking some treatment. Before that, we can give them some medicines to follow after also.
Right.
So 4 cases. I got 4 cases in stroke conditions. It all one is living. Though all are more than 80 years. They
Okay.
are all rescued. So that is my
Good.
experience. Sir, you are coming with new way of method, new way of everything. So we are very happy to see you all the time, because I am always absconding.
Yes,
Sir, your picture has gone.
yes, sir. There is some maybe video problem. Now we can invite our veteran, Dr. Sridhar Kurupu, sir.
Sir, Dr.
He is our guru.
Yes.
NIKUNJ TRIVEDI. I am remembering while I was in Anand Homeopathy College, there was college, only
Yeah.
few people. One among is yourself, and another is that our Prabhu Barbaria.
Yeah.
You are the two people are the that the foremost in the front, that combating each other. Who is the first? You are
Actually, he was my
the
junior. He was 1 year junior to me. I was senior to
yes.
him.
Still, I
Yeah.
remember you
Yeah.
both.
Yes.
How
Yeah.
many other persons I may not
Mm,
remember, but I
mm,
remember very few people. You all are
mm,
coming into the front row of the homeopathy. I am very glad.
mm, mm,
I am
mm.
very thankful to you all. I am also teaching for few years in that Deve College, so I am very proud about you people. Thank you very much for your. I heard only the half, so that what I heard, it is very nice. You come again,
Res-
very nice.
Sure, sure, sir. Sure.
Have to meet
You
you.
are remembering Dr. Prabhu. Recently, I visited Bombay,
Uh,
and I'll show you the picture.
okay.
Prabhu with me.
Yes. Okay. Thank you. You are the two topmost people in our college, getting
Yeah.
maximum marks and ranks.
Yes.
Yes, yes, that's the reason why Dr. NIKUNJ Trivedi becomes so popular among homeopathic doctors because of his immense knowledge, his intense desire to propagate homeopathy, intense desire to share his knowledge, everything, whatever thing with him, he's always coming forward to deliver to the future of generation. That's what I have to say about. Now I'm inviting Dr. Hibbert to say a word of thanks to the session.
And before going to that, I think that Abraham Vaidyan want to say something.
Yes, Dr. Abraham Vaidyan. Please unmute. Please unmute. Yes.
Hello,
Abraham
Doctor.
Vaidyan. Yes.
Doctor, thank you very much for your valuable presentation.
Thank you.
I heard this word iatrogenic, the iatrogenic disease 40 years back when the limits to medicine is translated in Malayalam. In that book, it is always about iatrogenic disease, but I didn't get any class about this subject. First time I heard a class from a homeopathic doctor for this purpose. Okay, thank you very much. Thank you for some.
You're welcome, sir. You're welcome.
Dr. Abraham Vaidyan was a former chief medical officer at government service, and he has done a wonderful job. And he was very much popular in the treatment of snake bite.
Oh, yeah.
That is a specialty about Dr. Abraham Vaidyan.
I have read that article.
Yes, sir.
I have read that article, yes.
I remember all the time you are coming to our platform for encouraging us with
Thank you.
good words, and because from the beginning itself you are in the field, but you all the time you have given some experience, some way of taking the cases, how to our approach, how to be our approach, and your way of taking classes, and all the time you are putting new things into the platform. We are very much grateful to you. You persons always engaging. Whenever we call you, that time you are in presence. So thank you all, doctor.
So for
Thank
that,
you very much.
I remember one thing. I remembered one thing. In a when there is one gynecologist, Dr. Tabor, he wrote a book, and on his first page of the book, what he has written, that is really, I remembered, that what has happened will happen again. What has been done, we still must do. Nothing under the sky is entirely new. I remembered that thing, and I'm implementing that thing, that whatever I'm doing, it's not a new thing. It's not a new thing. But I have to give something better. It has already been done by our ancient rishis and all. But we are just giving a new shape, new facets to present in a different way.
Thank you, sir. Thank you.
Thank you.
Thank you, Dr. Hibbert, Dr. NIKUNJ Trivedi, sir, Dr. Sridhar Kurpa, Dr. Abraham Vaidyan, and those who attend the session in this evening. And tomorrow we will have a session from Dr. Jolie. She will be talking about hyperthyroidism and homeopathy. With that, we
So
into
before I leave, can I put one proposal that with the IFPH,
Yes, sir.
can we start a homeopathic college of IFPH in England? Just discuss this thing
Yes.
with all the committee members. And if we can start, then I'm here to help you. And we will establish a very good college over here. Because right now, Hanuman College has been closed. And we can
Yes.
start a new college under the name of IFPH. Just put this proposal and just send me the message. I'm here to help you, and we will establish a very good, because IFPH has a very good network from all over the globe. So all the students can come and we can do something better. Okay?
Yes,
Now
sir.
you
We will.
continue with your Malayalam session. Thank you very much. And really, I appreciate for inviting me. I'm really honored. Thank you.
Thank you very much, sir.
Thank you.
Over to Dr. Mariam John.